Setting up the necessary care infrastructure as well as better housing support are the suggestions by MPs to help seniors age well in place. It's in response to a vision laid out in the recent budget speech for seniors to spend their silver years in the community instead of in institutions. More targeted services are also among the recommendations, in addition to ramping up the number of active ageing centres, otherwise known as AACs.
We should also consider providing overnight respite and palliative care for seniors living nearby. And AACs can be largely staffed by part-time and full-time seniors and be homely rather than clinical. Residents can work with the community to make it feel more like a group home, and conversions can therefore be done relatively cheaply. Furthermore, in both HDB estates and private estates, we need assisted living service centres to provide affordable and basic services.
In Singapore, Mr. Speaker, sir, the percentage of seniors over the age of 65 living alone or with other seniors increased from 29% in 2010 to 41% in 2020. If this trend continues, the elderly will require smaller living spaces, which are easier to maintain. I suggest that a silver housing bonus scheme, which enables the elderly to supplement their retirement income if they downsize to HDB treatment flat or smaller, could be made more attractive to improve the take-up rate.
There's also been a call for more streamlined caregiver support. For instance, having dedicated care coordinators journey with caregivers, especially those from lower income families.
They can guide caregivers to access practical help. They can also help to look out for caregivers' psychological well-being. A coordinator can spot early signs of caregiver mental stress and provide timely intervention. If we believe families should be the first pillar of support, we must keep innovating better forms of assistance for the very people who are trying their utmost to live out that value, especially those who are less financially privileged.